solely around the core 360 breathing that we talked about. So throughout all these exercises, if I do not mention that you should be doing breathing, just know that all through these exercises you should be engaging that core, bracing the core and the sides, and making sure you're breathing out and through here as well, not so much in the chest. So I'm going to get started in these exercises. I will post a handout soon with the actual static pictures and the description if you cannot watch the video, but the video will kind of go in depth of correct hand placement, correct foot placement, everything like that. And if you have any questions, like always, give us a comment and we'll answer it. Okay, everyone, this first one is called tripod. This is something that you can do in between the 4 to 6 week postpartum mark. The first thing you're going to do is you can start on your hands and your knees, plant your hands in front of you like this, your fingers spread wide open, and then you're going to plant one foot next to that one hand. Doesn't matter what side you start with. Make sure that other knee is just in that 90-degree angle, and so is this one. And making sure before you start to engage your breath that you have a neutral spine and that you're not caved like this or hunched like that. So we want to make sure that we're planted, plant our foot, neutral spine. We're going to start breathing into this. Start breathing, making sure that this is maybe hitting your thigh or coming out like this, and that you're not excessively rising in your chest. So hold this for about 30 seconds, focusing on your breath. And then you can switch to your other foot. If you are not able to do this, and not hit your hands directly on the floor, your foot directly on the floor, either with abdominal pain or anything like that, you can place blocks where your hands are, or blocks where your knee is to raise that up to you more level. Totally okay with what you need to do, and make sure that you're engaging your breath in this one. All right, everyone, this next one is what I call mama squats. So it's something that we're doing about 6 weeks postpartum. You don't want everyone to get super into the fact that you have to do a deep squat. That's not something that we're going to do until after the 6 week mark. Right now we're just focusing on staying above parallel, so we're not down like this, where our knees are, or our hips are above our knees. So just like this, not like this. So the best thing to do to cue this is to have a chair or something like that to be able to cue you to sit down onto the chair. If you cannot get as low as one of your chairs, you're more than happy to put a pillow on top of the chair to assist you to not be going so low. So you're going to start coming down, legs about hip width apart. You're going to start squatting like this. Remember, the hips are above the knees, we're not going down. We're just going to sit for about 3 seconds. And we're going to control our breath, make sure that this is not rising and this is rising. So a good cue is to make sure that this area right here, this diaphragm is hitting your legs, so that we're getting a deep 360 breath. And then rise up very slowly, controlled, focusing on that breath for about 3 seconds each. All right, everyone, now that we've hit our 6 week postpartum mark, this is a new move for you. You've seen the tripod. We're now going to move into the tripod with opposite arm extensions. So this is something a little bit more focused on stabilization of your core and engaging some of the, the transverse abdominis and all of that. So you've seen the tripod. I'm going to go through it again. Then I'm going to add in the arm extension. The biggest thing is to remember, still engaging that core, 360 breathing, focus on your breath, no chest rising, no chest breathing. Some chest rising is okay. When I say no chest rising, I don't mean, don't hold your breath, don't breathe, but make sure that you're trying to centralize your breath into your diaphragm, into your belly. Okay, so I'm going to show you the tripod first. You remember, you plant your arms. Make sure you have pretty good stabilization in those elbows. You're going to bring one foot forward. Remember to make sure we have a neutral spine, so kind of lock in those shoulder blades, making sure that we're not doing this or we're not doing this, okay? So the first thing is to make sure we have the tripod correct. So lock in those shoulder blades. The next thing we're going to do is we're going to start to engage very slowly the opposite arm up, like this. Hold it for about 3 seconds. come down very slowly. Remember, we're focusing on stabilization and breath, making sure we are locked in this position. So once again, engage the shoulder blades, make sure your core is correct, and start raising and down. Making sure we are not shifting like this to go up, we're not moving our hips like this up and down, and that we're not going like this, okay? So making sure that we're engaging our core in this. Do not hold your breath in this position. If you're finding yourself bracing because you're trying to be stabilized in this position, stop what you're doing and refocus on your breath and try to make sure that we're doing our 360 breathing, all right? So now we're going to progress into more what we can do about the 8-week. All right, mamas, you've made it to that 8-week mark, so now we can start doing full deep weight-bearing squats. So this isn't your traditional squat where our knees are parallel and hips are parallel with the ground like this. We're going to do a really deep squat like this. So the first thing I want you guys to focus on is when you're doing this position that we don't have any pain in the groin area. If you have pain in the groin area, please stop. If you have any pain in your abdomen, please stop and then consult with your healthcare professional before getting cleared to do these exercises. But these are safe to do in the 8-week mark. So I'm going to show you how to do this. Like I said, not as traditional as your normal squat. This is more of engaging not only the breathing diaphragm, but the pelvic floor diaphragm. If we get a good unison breathing with these two, we start to eccentrically load, which means lengthen the pelvic floor muscles so that we can have some relaxation in them instead of spasm and tightening, and then we can progress into strengthening them with this eccentric or loading elongation of everything. Okay, so start with your feet a little bit wider than your hips, and you're going to come into a really low squat like this. The biggest thing is to make sure that our knees aren't in like this and pinching those adductor muscles in there. And you can put your arms like this if you would like. Hold this for about 10 seconds if you can. Another thing is if you cannot do this exercise and hold this, making sure that you're getting your core 360 breathing, so your stomach should be hitting your leg. That's a good cue, and that we're not rising our chest as much. Focus on that breath. Elongate. You should feel kind of dip into your groin area. That's a good long elongated breath. If you cannot do this, like I was saying, you can put a pillow underneath you to kind of raise the ground up to you so that you're not as deep in weight bearing. You can come up a little bit by putting the pillow